I want to just revisit the conflicting message on trick-or-treating between certain levels of government. I know you don't want to be the bad guy in this, but Dr. Tam said it was okay, and now we're hearing from some infectious disease experts that it's about as low risk as it can get. Our local chief medical officer of health does agree with you, but the reaction we're hearing within our community is people are just overall frustrated and tired of being confused by guidelines they say are not all aligning. So how concerned are you right now that you might be losing people's willingness to listen?
Well, again, I don't think the guidelines can be any clearer. We have Dr. Etches from Ottawa on side, Dr. DeVilla from Toronto, we have York, we have Peel, we have all the chief medical officers, and yes, you can find a few docs that will disagree all the time. We find all the time a certain group of them, and you know, if I followed some of the advice that I heard from those same people at the beginning, it would be a real disaster. You know, so I could look at it both ways, but I have to take the advice of the chief medical officer, which I have, and move forward with it. But it's very clear. I don't want to. I'm not canceling Halloween. What we're highly recommending: do not go door to door in the hotspot areas. And we've seen it. And if we didn't act quickly, by the way, in Ottawa, I had a good briefing with Dr. Brown. And, you know, if we didn't act, we'd be going over the edge right now in Ottawa, as he mentioned. So I'm glad we made the decisions that we made to keep the people of Ottawa safe. They aren't easy decisions, I'll tell you that.
Follow up?
Mm-hmm. Yes, certainly not easy decisions. And in terms of enforcement now, with people who may be piling their kids into the car and driving 30 minutes outside of Ottawa to still give them that trick-or-treating experience, or people may be having house parties or larger than they should gatherings inside the house because now they're being told not to go out and trick-or-treating. What's the plan there for enforcing rules?
Well, right from the get-go, and it's a good question, right from the get-go, the enforcement is trusting the people of Ontario that we've been trusting ever since the beginning of this pandemic, that have been the vast majority of people are listening and going by the guidelines and protocols that we've set out. If you want to load your you know, a whole bunch of kids in the car and drive 30 miles or whatever, we don't have enough police. We can't be checking every single car. We can't be checking every single area. If someone has a house party, well, they're being reckless and they're being careless. Guys, the only way we're going to get through this is by you know, following the protocols and the guidelines. It's proven, not just here, but around the world, that if you do these steps, we have a better chance of you know, lowering the cases, getting back on our feet. We did it once before. We can do it again. We will do it again. But I understand, you know, people, as I said the other day, people are on edge. I get it. I hear it out there. I understand it. But again, we have to go with the health advice that is given to us and make a decision based on the advice we're getting from the docs.
Chief Public Health Officer has said in hotspots like in Ottawa and Toronto that Halloween's canceled, despite the fact that Dr. Tam and Dr. New have said on multiple occasions that it's a safe activity that people can do. What do you say to parents and kids who are frustrated about conflicting health information that led to Halloween being canceled in these cities? And on a personal level, are you going to be sending your kids out for Halloween this year?
I think it's really important that Canadians across the country listen to their local health authorities. We know that it's not easy and it's frustrating, and we're trying to get through this pandemic as best we possibly can, and to do that we have to reduce community transmission, and unfortunately all of us are having to make sacrifices of different types, particularly kids, in really difficult situations. Listening to public health officials means that my family will not be going trick-or-treating this year, because in Ottawa and in Ontario, in red zones like Ottawa, they are not encouraging or not recommending trick-or-treating, and therefore we won't be. A friend of mine suggested that maybe we could do an Easter-style treasure hunt for candy throughout the house and yard, and that's something that we're also reflecting on. I think families will be creative in how they respond to giving their kids as fun a holiday as we can, while always listening to public health officials and respecting local guidelines.